the stream.
Okay. Should I go ahead and open my power or make
Yes,
my
you can go
PowerPoint
ahead and
screen?
yeah, you can go ahead and put
Okay.
yep. Alrighty, so now we are live. Hi everyone. Thank you so much for joining us today. Today is our first session of the new year, so I hope you all had a happy new year. And I'm very excited to introduce Dr. Maniscalco. She's going to be presenting about general dentistry today. So whenever you're ready, doctor, you can take it away.
All right. Hey, everybody. Thanks for having me on. I am Chelsea Maniscalco. I'm a general and cosmetic dentist in Birmingham, Alabama. So this is me, and this is my husband, Lee. He is also in dentistry. He's an oral surgeon. And this is our dog, Jackson. A little bit about me. I grew up in Atlanta, Georgia, but then I went to dental school at UAB School of Dentistry down in Birmingham, Alabama. And that's where I met my husband. He was in my class. So, tell you a little about my journey to becoming a general and cosmetic dentist. I started my undergrad career at Wofford College. It's a small liberal arts school in Spartanburg, South Carolina. I majored in biology and Spanish. I was the captain of the women's soccer team, and I got into dentistry after shadowing a local dentist up there. He was an excellent mentor and teacher to me. He allowed me to shadow him in the beginning, and then the following year, he let me assist him. He even brought me to a free clinic that he was a part of, and just let me work with him there, and just really inspired me and helped me a lot throughout my journey to uh, get to dental school. So I really encourage all of you to find a mentor like him if you don't have one already, because he was so invaluable to me. So from there, I went on to dental school at UAB, like I said, in Birmingham, Alabama. And I was very active in a bunch of the student organizations there, like ASDA, which is the American Student Dental Association. Definitely encourage all of you to become a part of that when you do join, or when you do get into dental school. Organized dentistry is really important. I was also a member of AAWD, which is a women's organization, and I helped with a lot of other community service projects while I was there. And I was also a National Health Service Corps scholarship recipient. The National Health Services is an organization that places physicians, dentists, nurse practitioners, and I think a few other different types of medical practitioners in like underserved areas. So for me, I agreed to work for 3 years in an underserved area after graduation. And in return, I was given a scholarship for 3 years, and they gave me a stipend to live on while I was in dental school. So it was a really great opportunity for me. I really encourage all of you to look into that because dental school is not cheap, and it was a really great way to come out with a lot less debt. And also, it put me in a really cool community starting out of dental school where I got to see all sorts of different types of dental emergencies and just different situations that I probably wouldn't have seen if I had just gone straight into a private practice setting. Um, and now I finished up that commitment to the National Health Services, and I am currently working as a general and cosmetic dentist in Birmingham, Alabama. So, what is general dentistry and cosmetic dentistry? So, general is everything restorative, like fillings, fixed prosthodontics, like crowns and bridges and implants, removable prosthodontics, dentures and partial dentures, extractions, like when we take out teeth, root canals, which are an alternative to taking out a tooth, being able to save it, where you have to clean out the inside of the tooth in order to remove the infection, and pediatrics, which is just working on kids, obviously. And then In my particular practice, cosmetics includes things like whitening your teeth, like just um, brightening your smile, doing crowns, veneers, and smile makeovers, which is basically just a fancy way of saying patient comes to me and wants to improve their smile. And then I also do Botox and dermal fillers. And that is not something that every general dentist does. It depends on the state that you practice in, because not all dentists are, or not all states allow general dentists to do Botox and fillers. So that's a state by state thing. So my advice for you guys while you're in college is, first of all, maintain a high GPA and all the prereqs for dental school, but also in whatever you're majoring in, because dental schools care that you do well, obviously, in your sciences and everything that they're looking at for dental school, but they also want to see that you're doing well in what you chose to major in. You also need to have a really well-rounded extracurricular activity sheet. Like, for example, I was on the women's soccer team. I also was involved in a lot of other clubs. I was in a sorority, and I did a lot of volunteer work. You also need to do really well on the DAT and PAT. Depending on the dental school you go to, some look at the PAT more than others. I went to UAB and they put a big emphasis on that because they wanted to see that you were good at being able to see things in a mirror, like be able to imagine things upside down in your head. I used Kaplan and Crack the Dat for my studying. Crack the Dat was probably the best thing I could have invested in. It had a really great part to help you practice for the PAT. The other thing I encourage you to do is get as much shadowing in as you can in general dentistry. Don't focus on a specialty right now. It's totally fine if you want to do a specialty, but this is not the time to focus on that because dental schools are looking to make general dentists. They don't want a bunch of people that want to specialize. I'm not saying that they don't encourage you to specialize once you're in, but you're trying to get into dental school, and dental school is about general dentistry. Um, and then finally, mock interviews are very important. Practice for your interviews as much as you can. My college had a really great career center, and they had counselors that would do mock interviews with us that were like knowledgeable about dental school in particular, and some that were just for interviews in general. So do that as much as you can. If you don't have that at your college, I recommend that you either find someone who maybe is a little bit ahead of you and has already gone through the application process and see if they'll help you, or reach out to maybe a local dentist in your area and see if they'd be willing to help you. So, a typical day in general dentistry, we start our mornings with a morning huddle, which is just where we go over the schedule all together, talk about all the procedures that I'll be doing that day and what I may need for a particular procedure. The hygienist will go over her patients with me as well, and we'll look through her charts and see if any of the people that are coming in have unfinished work that needs to be done, and we'll look to see if there's maybe any gaps in the schedule where we can fit them in that day or things like that. And then the way my office works, we see patients from 8 to 1 for our mornings, and then we have lunch, and then from 2 to 5 in the afternoon. So I'll see about 3 to 4 patients in the morning, and then I will do hygiene checks in between, which is just where I go in after the hygienist finished cleaning and look to see if there's any treatment that needs to be done, or just check to see how the patients are doing. And then same thing after lunch, just 2 to 3 patients instead. So the kind of things that I see on a day-to-day basis, people come in with tooth pain. Someone may come in, I get this a lot. They're like, I chipped my front tooth. I need you to fix it, please. They'll say they're having sensitivity on teeth. cosmetically, they want to improve their smile, people with joint pain, and then in my particular practice, getting rid of wrinkles, and I do that with Botox and fillers. The things that I don't do at my practice are difficult root canals. And that would be something like a calcified canal, an extremely curved root, or a root canal that's through an existing crown. So if you see this bottom left picture over here, this is a tooth that doesn't necessarily need endo, but it was just an example of a really curved root that I'd more than likely refer out. And you can also see right here that there's probably a second root going there. So it's just a lot more um, complicated, and it would take me a lot more time than a specialist. So it's just worth my time to send that to a specialist where they can do that quickly for the patient, and I can be doing something that I'm more proficient at. Same thing for impacted third molars or wisdom teeth. This x-ray right here is a Panorex. It's a 2D image of like all of the teeth at once in your jaw and your sinuses. So these teeth over here are impacted wisdom teeth. And as you can see, they're kind of up in the sinus as well. So that's kind of not anything that I like to do. Something my husband does on a day-to-day basis. So I would send that to him. I also don't do orthodontics in my practice, so I don't do braces. I'll send that to an orthodontist. And then I also don't do advanced TMD or temporomandibular disease, which is like really advanced joint pain that needs to be corrected with surgery. So I will talk to you guys now about a couple cases that I've done. This was pretty early on in my career coming out of dental school. I did something called composite veneers for this patient. If you look on the left here, you'll see her original smile. She came in and her complaint was her teeth were really short and they were really yellow and she didn't like them. And she just wanted to improve her smile. And so we went over some options with her. In this case, the best option would have been to do crowns for her along all these front teeth. However, that wasn't something that she could afford to do. So the other option I gave her was composite veneers. It's a good temporary solution for a patient. And a lot of times it can be something just to show them like what they could get with crowns or veneers long term. And so we went with the composite veneers here. And as you can see, I was able to lengthen her teeth and make them a lot brighter. Um, uh, And this is my second case I'll show you guys. It's an anterior bridge. This patient was going to have to lose this tooth right here um, because she had an infection, and unfortunately we wouldn't have been able to do a root canal to save it. So no one wants to go without a front tooth. So we gave her some options of an implant there after extraction, which is like a really good permanent fixed solution for just that single tooth. We also gave her a flipper as an option, which is just a removable partial that you can take in and out. Most patients don't really like that option because they don't want to have something removable in their mouth. This patient decided to go with the anterior bridge, which was another option I gave her. And that is basically um, three crowns all fused together. This would be a crown, this would be a crown, and this would be a crown, but this is just a fake tooth on that, and they're all fused. So that ended up being a really good aesthetic option for her because as you can see over here on the left, she had about three different shades going on between all these three teeth, and really none of them matched the other side very well. So by doing this bridge, we were able to match her existing crowns that she has on her left side here much better. And she was really happy with the final outcome. So my advice to all of you guys as future dentists is study hard, make good grades, shadow as much as you can, which I know is kind of difficult right now with COVID and everything going on. But when people are letting you back in to come into their offices, do as much as you can. And I would also encourage you to focus on dental schools with the most clinical experience. There's nothing wrong with wanting to go to a big name school, but at the end of the day, all that matters is whether or not you know how to do the dentistry. And so you want to find a school that gives you the opportunity to do that dentistry as much as possible while you're in a learning situation. So that can change at a school from year to year. So just do your research. When I was at UAB, it was an absolutely awesome clinical experience. I had so much opportunity to work with patients. So you just have to do your research and ask students that are already there, and that's how you'll find out. So thank you guys so much for having me on. I've really enjoyed presenting to you all. Thank you to Krupa for having me. And if you guys want to follow me on social media, I have an Instagram account down here. It's Dr. Maniscalco. I post some cases that I do and just like little factoids about dentistry and then little personal things every now and then. So I'd love for you to add me if you want. And that's all I have for my presentation. I'll be happy to answer
Awesome.
any questions.
Yeah, thank you so much, Dr. Maniscalco. We really appreciate you taking the time to
Absolutely.
create that presentation for us. And Yoon, if you could go ahead and take some questions from the chat.
Yes, thank you for that presentation. I'll just ask you some questions from the chat.
Absolutely.
So the first one was, is there some sort of training or course that you did to do Botox?
Yes. I did the AAFE Botox and dermal fillers course. It's generally like a 2 to 3 day long course that they offer, and they do a lot of. You have to do a bunch of training leading up to the actual course online, and then it's like 2 full days of patient training live. So
Going along that question, did you take any additional courses to become a cosmetic dentist?
I have taken a lot of continuing education since coming out of dental school. I joined this one group called the Crown Council, and they have a young dentist program that offers a lot of training on smile makeovers and smile design. So I'll be actually going out to Salt Lake City, not too well, in June to do another course on that. And a patient of mine is actually getting a free smile makeover at that, and I'll be learning from a really uh, renowned general dentist that does all of that. So yes.
So for the Botox and fillers that you do, what are they usually for?
So a lot of people want their forehead or in between their eyes and their crow's feet done just to minimize their wrinkles. Uh, Fillers, a lot of people want fuller lips, or you can do something called the marionette lines right here. Um, they're those are the most common things people come to me for.
The next one is, how did you balance soccer and academics as a student?
Um, Honestly, it made things easier for me because it made me I had to manage my time, or I had to study with the small amount of time I had, so it made me a lot more efficient in my studying. But I guess I always was an athlete, and so I learned to manage my time quickly, and it taught me to do that.
What do you think about AGD and GPR residencies?
I definitely think they're valuable, especially if you're wanting to learn a little bit more than what your dental school offers you. There's a lot of AGDs and GPRs that teach general dentists how to place implants, for instance, or you may find some that help with endo, like do molar endo or something like that. So I definitely encourage you to do that if it's something that you want to do.
So what are the benefits and drawbacks of general dentistry as opposed to specialization?
Well, I think one of the biggest pros of general dentistry is you're not limited to just one specific area. Like I can do everything that a specialist does so long as I perform it to the same level as a specialist can do it. And then I can refer out whatever I don't want to do. Um, so I think that's a pretty big pro about general dentistry. But uh, if you really like a specific aspect of dentistry more than any other, then I think a specialty is a really great way to go. For instance, my husband, he hated doing crown preps and fillings and everything, but he loved surgery. And so oral surgery was a really great option for him.
Do you have any advice for asking dentists to shadow them as a pre-dental student?
I would just call as many local dentists as you can and introduce yourself. Tell them that you're wanting to go into dentistry. You'll be hard pressed to find someone that isn't willing to help you in dentistry. Most dentists are like pretty open to having someone come in and shadow them. I certainly don't mind. I'm not always the best at talking while I'm in the middle of a procedure, but I'm always happy to have someone come in and watch me because I really appreciated when someone did that for me. So
Did you take a gap year between undergrad and dental school?
I did not. I went straight in.
If someone is interested in a particular specialty, should they not mention it in their application?
I don't think it's necessarily a bad thing to mention it in your application, but I think you need to, especially if it's like what drew you to dentistry in general. But I think you should lead with the fact that you just want to be in dentistry in particular and not be so focused on saying, well, I only want to do oral surgery or I only want to be an orthodontist.
Next question is, do you have any opinions on studying abroad before dental school?
I highly encourage it. My college offered January terms, and I did that several times. I think it's a really great thing, and I know that dental schools certainly see that as a positive for being able to like know about other cultures. UAB actually had a exchange program with a Japanese dental school that they allowed us to do, and with a French dental school. So I think I think there's definitely a place for that.
So how are composite veneers placed, and what is the patient process of a patient getting composite veneers?
So it's you shave off just a little bit of tooth structure in some instances. For this patient, I didn't actually have to take away any tooth structure. It was kind of nice because she wanted longer teeth. And then you use something called etch, which basically just prepares the tooth surface for your filling material. And then you use a prime and bond, and then you place the composite filling material, which is just like tooth colored filling material. Um, you can get your lab that you use to make you something called a wax up, which is just like a mock-up of what the patient's teeth will look like after you're done, and from that they can fabricate a matrix for you to use that helps you like builds the tooth up. I wish I had a picture of one to show you guys, but um, that's really helpful.
Um, how long do composite veneers typically last?
Um, I would say, I mean, we had to touch them up every now and then, like over the course of 6 months or so. So I just depending on the patient's bite and all other things, like if they grind or anything like that, like it could last for several years, but you're definitely going to have to touch it up every now and then because they're going to break something, even if they're super careful, because filling material just isn't as strong as regular tooth structure. And so it's going to break every now and then versus if you did like a porcelain veneer, which or a crown, which was what I was hoping to be able to do on that woman in particular. um, that should last like for 10 to 20 years, depending on how well she takes care of her teeth. So
Where did you do your NHSC scholarship?
my first year, I was in Tuscaloosa, in a like inner city area. And then the last 2 years, I was in Centerville, Alabama, in a rural community in a like public health setting.
And how competitive is the NHSC scholarships? And did anything make yourself unique to receive it?
It's a pretty competitive scholarship program, from what I'm told. I was one of, I think, like 5 other students in the country that got it that year, for dentistry at least. Um, One thing that can help you stand out for that is to be willing to work anywhere, and I was willing to work anywhere. I saw it as a great opportunity to maybe live or go somewhere that I had never been before. You also need to have a heart for service and wanting to help people, because they're looking for you to go into an area that really needs help. Another thing I think that helped me stand out is I can speak Spanish, and I really enjoy using that. And so I was able to help a different population than some other people may have been able to.
Did you ever want to specialize in anything?
I considered oral surgery at one point. I really like pulling teeth and doing things like that. But once I got the National Health Service scholarship, you don't have to do you have to do general dentistry to do the NHSC or pediatric dentistry, because they're looking for people in primary like primary healthcare, basically, which general dentistry falls under that window. Um, and so I kind of made the decision after that that I was at least going to do general dentistry for 3 years, but obviously I've continued to do that since, and I'm really happy with it. So
Is research necessary to get into dental school?
that is also an important thing to do, yes. I did research at MUSC in between my junior and senior years of college. I want to say, what did I do? I worked on head and neck cancer research. So, yeah, I definitely encourage that. Dental schools are looking for that for sure.
Is residency required for general dentists?
It is not. You can go straight into practice as soon as you graduate dental school. I had several classmates that actually bought practices and uh, started seeing patients like almost immediately after we graduated. So
Did you work while in dental school?
I did not. I just focused on school, and I was fortunate to have that stipend from the National Health Services. So that kind of allowed me to not have to work, which was really great.
How long do fillers usually last?
Fillers can last anywhere from 3 to 6 months. It depends on the kind of filler. They're reversible fillers will last anywhere from like 3 to 6 months. And then there are some that can last anywhere from like 1 to 5 years. And then there are some that will stay there forever unless you put in something to reverse it. So it just depends on the kind you use. But I only ever use the kind that lasts 3 to 6 months.
What did you do to study efficiently in undergrad?
Um, well, it's a great question. uh, I just, whenever I wasn't at soccer practice, I had like set study hours that I had to get things done. And when I was studying for the DAT, excuse me, had an alarm go off. I just had a set schedule every day for like, these are the hours that I'm going to study, and I need to get through X amount during this time. So I just I always had a study plan, and that's how I stayed on track.
How did you balance life during dental school?
Um, it wasn't too bad. Uh, the nice thing is you're in school with like 60 other people that are wanting to do the same thing as you. So you have automatic friends as soon as you enter into dental school. So even if you're studying with your friends. It's a lot like college in that way. But you just have to, at the end of the day, realize like, yeah, you're in school to learn this for your profession, but you have to still have a life as well. So,
What are your thoughts on minimally invasive dentistry?
uh, like, just like conservative dentistry, I guess.
I think so.
Okay. I am always for the most conservative treatment possible. I'm probably going to watch something for longer than maybe someone else might, but I'm always going to try to do something preventative before I just jump into drilling on someone's teeth, or I'm going to do whatever I think I would want someone to do to me or one of my family members.
Can you talk more about your experiences at UAB?
Sure. I really loved my experience at UAB. Like I said, the clinical experience was awesome. We had a ton of clinical requirements our third and fourth year, which seemed really overwhelming at times, but I'm very thankful for it in the end because I came out feeling very confident in a lot of the procedures. Not to say that didn't that I knew everything, because I certainly didn't, and I learned that my first year out of school very quickly as well. But UAB was great. They get you in the clinic your first year, just like rotating and like assisting the older students. I'm trying to think. They're let's see, first and second year you have systems classes with the optometry students where you're going through like all your sciences and everything. Um, Second year is a little bit more of like dentistry focused on your didactics. And then third year is heavy clinical and heavy didactic. That's a really tough year. That's probably the toughest year. And then fourth year um, is heavy clinic, and still have didactic as well, but um, not as many classes as you did third year.
What is your favorite dental procedure to perform?
Mm. Uh, I like I said, I really like to do extractions, but I also really like to do um, crowns and bridges. It's really enjoyable. And I like to do Botox a lot because it's just really different than anything else that it's not like normal general dentistry, so it's just something fun to do on the side.
How would you answer someone asking you why you chose dentistry?
I chose dentistry because I always knew I wanted to be in healthcare, and I really loved the fact that dentistry, there are a lot of people that come to you with like a very urgent or immediate need, and you're able to help them in that moment, versus like in some types of medicine where you got to try a couple things before you figure out like what the right medication is for a patient, or like what's going to help them with their like systemic illness. Like dentistry has the ability to be like, oh, you're having a tooth pain right here for X, Y, and Z reason. I can help you by doing this root canal, and then you'll immediately be out of pain.
Do you have any specific tips for interviews?
Um, Practice as much as you can, like I said, be very confident, and always maintain eye contact with whoever you're talking to, and try to make yourself stand out in some way.
Um, can you talk about the pros and cons between work and personal life in the field of dentistry?
Um, I think dentistry is a great work-life balance, or has a great work-life balance, especially um, being a female. You can work as much as you want or as little as you want, and still have a pretty great life. Most dentists work 4 days a week. There's definitely a lot that work 5 days a week as well. I did my first years out of dental school. I now work for 4 days a week mostly, but I pick up some extra days every now and then. But I would say dentistry is a really great combination of being in healthcare, but still being able to have a life outside of your job.
Going back to the research,
Mhm.
does the research have to be science related?
I would recommend that it's science related, and if you could, it would be great to have some sort of like dental focus as well. I mean, it's not absolutely necessary, but it will certainly look better.
Can you talk about corporate dentistry over working in a private practice?
So they both have their pros and cons. I have classmates that have done both, and some really love corporate dentistry. They say that it's great in terms of building up their speed and getting more proficient at uh, procedures because you have to see so many patients in a day. Um, but one downside to corporate dentistry is most time most instances of it, you're never going to have the ability to own your own practice or be a partial owner in the practice. You will always be an employee. And I think that's one of the greatest benefits of private practice. And it's one of the reasons I chose dentistry as well, as I could be my own boss. Um, and so private practice, obviously, you can do that. You can make your own hours. You can call all the shots. But yeah,
Have you always wanted to be a dentist?
um, I originally thought I wanted to be a physician for a long time, but in college, once I started shadowing that general dentist, I realized how much I really liked dentistry, and from there, I was pretty set. So I didn't know for sure until uh, probably halfway through college.
For interviews, did you ever get asked about how you overcame an adversity?
Yes, I'm pretty sure I got asked that question. Uh, I'll be honest, I don't remember how I responded, but yeah, that definitely sounds familiar.
Was it easy to make friends in dental school?
Absolutely. Like I said, you're with these people like 8 to 10 hours a day, 5 days a week, and y'all are working together all the time. So I found some of my best friends in dental school.
Um, how do you handle the posture of being hunched over every day, all day when working on patients?
Well, one thing you have to do is learn to have really good posture, and you won't hunch over. You'll learn to use your mirror, so that you just look through that to see the top of people's teeth. But it's definitely something that you have to train yourself to do, and there are definitely times when I have to correct myself, because that's a really important thing in dentistry to save your back, save your neck, or else you're not going to have a very long career.
Do you recommend applying to dental school as soon as the application opens?
Yeah, I would get your application in as soon as possible. Um, I I submitted my application as soon as I was able to. I ended up taking the DAT twice, so I submitted my first DAT score with my application, and then um, the second one, obviously, once it came in. Um, and that worked out fine for me. My interviews might have been a little later than some other people's, but uh, I'd say sooner the better. But I also would encourage you to take the DAT and again if you're not happy with your first score. And so long as the schools you're applying to will accept a second score or have like a late enough uh, application deadline for you to be able to get in a second score, definitely do it.
For someone who wants to work in an impoverished country after dental school, how would you suggest they approach the plan?
So, like working in a different country, you think?
I am assuming yes.
Okay. I'm not super familiar with how that would work long term. I mean, um, I went on a mission trip while I was in dental school, and I know a lot of dentists will do mission trips even in their career. And a lot of times they're connected through a church or there's an organization in the particular country that they're wanting to serve in that they just get connected with. I don't know much about like a long-term option for that, like if you're wanting to go live in another country and do that, but I'm very certain there are organizations out there that could help with that. I just am not familiar with what they are.
How many shadowing hours do you consider to be competitive?
When I was going through school, I want to say they recommended like 200 hours. So I'm not exactly sure what dental schools are looking for now, but I would strive for the more hours the better. It's never going to look bad to have more hours because they're going to know that you've seen a lot of dentistry and that you're sure that it's what you want.
Can you talk about diversity in UAB?
Yeah. Um, it was somewhat diverse in my dental school. I wouldn't say that it was a super diverse class, but we had a lot of different like religious backgrounds and some different ethnic backgrounds in my class. I do believe that it has gotten more diverse as uh, the years have followed since I graduated. I know they've taken a lot more females than they've ever taken before in the past few years. My class was about 50-50. And I believe the freshman class when I was a senior was majority female. So I think it's something they're working on and striving to be better at.
How do private dentists learn the necessary skills needed for running their own business?
That's one thing that they don't teach you enough of in dental school. A lot of it is through continuing education classes. A lot is by trial and error, and a lot of dentists like go into partnerships with other dentists, and a lot of times there's one dentist that's older, and they like teach them the skills that they need to run the business to ultimately take over one day.
Do you recommend taking a business class during undergrad?
I think that would be very valuable. I wish I had taken more.
Did you change your study methods when studying to retake the DAT?
Yes, that's when I got the Crack the Dat study course, and that really helped me because I didn't do great on the PAT the first time around. I had a lot of trouble with getting getting through all of it quick enough because that's a timed section, and uh, it helped me tremendously. So I just followed that.
Um, is ecology an important course to take before taking the DAT?
I don't remember there being a lot of ecology on the DAT, but that was also 8 years ago that I took the DAT, so it could be different.
Um, how did you get into research?
My college actually connected me with, it was like a scholarship or internship you could do over the summer. So I applied for that and I was picked for that.
What was your hardest class in undergrad?
organic chemistry. That was very challenging for me, but I had a great teacher.
How many hours do you recommend a student shadow one dentist?
Um, I don't think there are too many hours that you could spend at a particular dentist's office. I do think it is important to shadow more than one general dentist, certainly, but um, I think as long as you have like 3 or 4, maybe 5 different dentists that you've gone through their practices, just so that you can make sure that you're seeing, because every practice is different. Like, not every general dentist is going to do root canals, because some dentists just don't like doing them, so they refer out all their root canals to a specialist. And you may find a general dentist that does a bunch of braces. So you're gonna see a lot more the more practices you go to, but I don't think there's like a specific number of hours you need to spend at each one.
When did you apply for the NHSC scholarship? Was it during dental school or while you were applying to dental school?
I applied for it during my first year of dental school, so that's why I only got a 3-year scholarship. You are able to apply once you've been accepted to dental school. You just like send in your letter of acceptance along with your application, and then you can qualify for a 4-year scholarship. They also have a loan repayment program that you can apply for. So, say you don't get the scholarship, I believe in like your 3rd or 4th year of dental school, you can apply for the loan repayment, and you agree to work for X number of years and they'll pay off like X amount of your student debt for you.
Do you think learning about the business portion of dentistry out of practice is beneficial?
Absolutely. Um, I do know a lot of, or not a lot, but some of my classmates like worked in a dental office prior to going to dental school and were able to get some knowledge about that beforehand, and I think that was pretty valuable to them. I didn't really have, other than the dentist that I had as a mentor, I didn't really have a lot of connections to dentistry prior to going to dental school, so that wasn't really an option for me. But yeah, learn as much as you can.
How long have you been practicing for?
I'm in my 4th year of practice right now, I'm like 3.5 years in.
How many dental schools do you recommend applying to?
I applied to 3. I would say applied to as many you you are okay with possibly having to go interview at. Um, but it's definitely not going to hurt you to apply to more. I wanted to stay in the southeast, and I had 3 that in particular that I would have been happy going to. So,
Um, how did you tackle getting a job after dental school?
well, for me, it was kind of easier since I was already committed to the National Health Services. They had a database that you used to find a place to work, and you basically just had to work at a location that had a high enough, they called them HIPSA scores, which was just like based on the need in the area. So I had to work at a 17 or higher. So I just looked for those around the area I was wanting to work, and they're like all over the country. So uh, that's how I did that. And then once I was finished with the National Health Services, I used dental supply reps and our alumni association at UAB to put out feelers for other jobs. And then you kind of just like make connections with people through like different like dental organizations you're in, and word of mouth.
Um, is it, do you think it's good to practice manual dexterity before applying to dental school?
Yeah, I think that can be very valuable. They do look for that kind of thing. I know, I want to say it might be LSU that makes you like carve a piece of chalk for a part of your interview process. So it's definitely valuable to have some sort of like hand-eye coordination leading up to dental school. That being said, though, like I played soccer, I did not have a lot of experience with hand-eye coordination prior, and I did just fine. But it will definitely set you apart to have that experience.
How many dentists did you shadow prior to dental school?
I want to say I shadowed like 4 or 5, but the majority of my shadowing was with that one general dentist that was around Spartanburg.
Um, what is your opinion about the trend that dentistry is heading to? I'm assuming this is in regards to procedures.
Uh, I don't. I'm not really sure. I know what they're asking.
We can move on. Yeah, I'm not sure
Sorry.
what the question exactly is asking for either. So when should pre-dental students start shadowing during undergraduate to be a competitive applicant?
I didn't start shadowing until my junior year of college, so I had to get a lot more done in a shorter amount of time. So I don't think that you can start too early. Like start your freshman year if you think it's something you're interested in, because then you have a lot more time to gain the hours you need. And also it gives you more time to make make sure that's what you want. Like you can look at medicine as well and make sure that you don't want to go to med school or PA school or something.
What are some things you would recommend for manual dexterity?
Playing an instrument is a good one. If you like to do pottery or painting, um, I think I had a classmate that did like wood whittling. Um, yeah, things like that.
Um, for the NHSC scholarship, do you know if there are any locations in Hawaii?
I'm sure there are. I didn't look into Hawaii, but I would imagine there's at least one. I can't say for certain, but if you just Google the National Health Service Corps, it'll give you information on like the application process, and I think you can also find the database for like where they have locations for jobs after, um, as well on there. And I'd be happy if any of you guys are interested in doing that, um, with talking to you more about it individually as well.
What business classes do you recommend undergrad students take?
Um, Anything having to do with like finances is a good one, or if there's anything out there to teach you like how to manage employees, things like that, because they don't teach you how to deal with employees not getting along or hiring and firing people, things like that, or how to manage your books, or how to market yourself or grow your practice.
Um, has COVID affected the number of patients you see?
Um, in the beginning, yes, when COVID first hit and we went, the state of Alabama chose to allow dentists to only see emergencies during lockdown, and so that certainly limited the number of people that I was seeing in a day. Um, but now I see about the same number of patients I was seeing prior to COVID. We just have a lot more precautions to take, obviously, and we're screening everyone before they come in and when they get there. And obviously, we're following all the guidelines for keeping everything clean.
Did you feel prepared after graduation at UAB for practicing?
I did. I felt very comfortable with everything clinically. Obviously, I still like had to learn a lot coming out, because I mean, even being feeling as prepared as you can, it's not the same. You're in dental school, you're seeing one patient in the morning and one patient in the afternoon in clinic. In a private practice setting, you're seeing anywhere from like 8 to 10 patients in a day, and also checking hygiene. So a lot of it was becoming more efficient after dental school. Like, I felt comfortable with all the procedures, but I still had to get a lot faster.
Going back to the trends question, the person who asked clarified. So
Okay.
he meant trends on procedures and technological aspects in digital dentistry.
Oh, like I whether I what do I think about that, or
Yes.
I think it's really great technology. Like, I would love to have a scanner one day in my office, so that I can take digital impressions for everything. And cone beam CTs are becoming more and more common in general practices. You can use them to look for cracked teeth. And if you want to place implants, it's pretty much like standard of care now that you need to have a cone beam. So there's some really cool technology that is already exists, but it's very expensive technology. So you're not going to see it like at every practice coming out. But hopefully you'll get to see some of it while you're in dental school, because a lot of the schools have access to it.
Does the research have to be related to health and dentistry, or is any research experience good?
I would say any research experience is good, but obviously if you could do it related to dentistry, I think that would be even better. But I think any sort of research will be valuable.
What kind of procedures do you learn in dental school compared to residency?
Well, that kind of depends on the dental school you go to. In part, UAB, we we did a little bit of everything. The only thing that I didn't get experience doing was placing implants, but uh, everything else I I learned as a dental student. But a lot of residencies, I assume they're talking about like a GPR or an AEGD in this instance. There's a lot of residencies out there that like will focus on molar endo, like I was saying, or placing implants, or more like advanced perio procedures. There's really like all sorts of different GPRs and AGDs out there that will focus on um, one more specific thing that you may be interested in, or a lot of different things. Like some uh, will require you to like take call with some of the physicians at a local hospital or something. So if you're like interested in doing something like that, there's avenues for that. Or some will focus more on like pediatrics. It really just depends on what you want to do.
Did you assist or work in a dentist's office during undergrad?
I did. The general dentist that was my mentor, he gave me an internship my senior year, so I assisted him during that internship.
And do you think being a dental assistant counts as shadowing hours?
Yes, it definitely does. Because you're right there, you're seeing everything. Probably better than when you're just standing there looking over their shoulder, honestly.
Do you have to be certificated dental assistant, or could a general dentist just train you to be one?
In Alabama and South Carolina, you can just be trained by a general dentist. You don't have to have like gone to a specific school to do it. I know there are certain states where I think you're required to have like a certificate from a school that you went through, but in both the states that have experience in, you don't have to do that.
I think that's all the time we have for questions. Thank you so much. I know that was a lot of questions, but
Oh no, I'm happy to answer.
Yes, thank you so much, Dr. Maniscalco, for answering all of those questions. And thank you,
Absolutely.
everyone, for submitting your questions. And we hope you all enjoyed the session. Thank you again, Dr. Maniscalco, for your presentation. And Yoon will go ahead and post our attendance quiz in the YouTube live chat. And you can also find it in our Instagram bio. And be sure to tune in tomorrow. We have another session at 6 p.m. Eastern. So thank you guys again, and I'll hopefully see you all tomorrow. Bye.
Thanks again.
thank you.